afternoon. Welcome to the ABA section on Civil Rights and Social Justice Rapid Response Program on the implications of COVID-19 on African Americans and communities of color. Before we begin, I'm pleased to inform you that the President of the American Bar Association, Judy Perry Martinez, has joined us and will provide brief remarks before.
Good morning, everyone, and thank you for joining us today and for your commitment to these critical issues that the webinar will address. Today's program focuses on the unique issues facing African Americans and communities of color during the COVID-19 pandemic. And for many years, African Americans have faced health disparities for a variety of reasons, as we all know, including lack of access to health care, pre-existing conditions that impacted insurance coverage and in so many other ways, and racial bias, to name only a few. African Americans are more susceptible to many of the underlying conditions that make them more at risk for complications from COVID-19. And in addition to health disparities, African Americans are also more likely to be, in some cases, less economically secured. And even with our brothers and sisters who are incarcerated or connected into the criminal justice system in some way because of our country's history, there are many in the African American community who are suffering in many ways. So these adversities are before us as we face the pandemic itself, and we have to be keenly aware of these impacts on this community to make sure that the obstacles that are there in facing our colleagues and so many more in the public are addressed in ways that will really make a difference in lessening the impact of the COVID-19 virus on so many who are suffering. Again, these are all issues that we want to explore today. These are issues that we think are so important. And there are many more, including voting rights and others, where we know that vulnerable communities will long, in fact, suffer if the right steps are not taken. We are grateful for the concern that all of you are showing by being a part of this webinar today. The ABA has long had an interest in eliminating these disparities and so many more, and forwarding justice for African Americans and communities of color and others vulnerable in our community. Presenting some of these issues today in this webinar form is one of the many ways we are trying to address and make sure that we are standing together in unity against this crisis. Please join us in the ABA if you're in fact not a member. As we contribute to these discussions, we bring forth the expertise and experience of the panelists that you'll hear from in just a few moments. And we are so grateful at the American Bar Association that they have come forth to share with you their knowledge. Now I'll turn things over to our wonderful moderator, Angela Scott. She serves as an attorney advisor at the U.S. Department of Health and Human Services, and Angela is chair-elect of the American Bar Association section of Civil Rights and Social Justice. Thank you, Angela, and thank you for allowing me to be a small part of this webinar.
Thank you. Thank you so much for taking time out of your busy schedule in support of this very important program. On behalf of the section, we want you to know that we appreciate you. As President Martinez stated, my name is Angela Scott, and I'll serve as the moderator for today's program. Before I begin, I need to let you know that I am speaking to you today in my personal capacity. My remarks represent my personal views and not those of the United States Department of Health and Human Services or any component of the federal government or the ABA. Likewise, the views of our panelists that will be expressed today have not been approved by the ABA House of Delegates or the Board of Governors of the American Bar Association, and accordingly should not be construed as representing the policy of the ABA at this time. They are the views of the individual presenters and in their personal capacities. During today's program, we encourage you to ask questions of our panelists. There will be time at the end for the panelists to address them. As an attendee, you should see a control panel with controls such as audio options, chat, raise hand, and Q&A. For the purpose of this webinar, we ask that you submit your questions through the Q&A, not the chat function. If you do not see these controls, please ensure that your screen is not idle by tapping your screen and moving your mouse around. Later, we'll be sharing a recording of this program to everyone who's registered so you can share them widely with your networks. And with that, we're thrilled to bring you today's program entitled Implications of COVID-19 on African Americans and Communities of Color. There's a popular saying among members of the African American community that I think adequately sums up the importance of what the section is highlighting today. And that saying goes, when white folks catch a cold, Black folks get pneumonia. We know that African Americans and people of color are in fact vulnerable communities for a wide range of reasons. Health disparities, economic instability, criminal justice, and access to voting are only a few areas in which, obviously, even prior to this pandemic, inequities exist. And while there are federal civil rights laws in place, such as the Civil Rights Act of 1964, questions are now arising in the face of a national emergency as to whether or not those laws will be enough to protect communities that might otherwise be impacted the hardest. Identifying these issues is the first step toward getting them on the radar of policymakers, healthcare professionals, and community leaders poised to create best practices and solution-oriented policies that can prevent or ameliorate some of these inequities. Our esteemed panelists today are Ashley Baker, Chair of the Criminal Justice Committee of the ABA Section on Civil Rights and Social Justice, Anthony Butler, President and CEO of the AIDS Interfaith Residential Services and the Empire Homes of Maryland and City Steps, Dr. Alethea Maybank, Vice President and Chief Equity Officer of the American Medical Association, and Juan Thomas, former National Bar Association President. Please note that detailed biographies of all of these panelists and reference materials that they refer to will be available for your viewing later on the website. So with that, I'm going to turn it over to Dr. Maybank. Dr. Maybank.
Great. Hi, everyone. So I'm just going to share my screen here. Okay. And hopefully everyone can see the deck. Okay, great. So thanks for having me. It is definitely a pleasure and honor to be here representing the American Medical Association. We are an association geared to promote the art and science of medicine, as well as the betterment of public health. We represent, as membership, 210,000 physicians, but we definitely would love to be the voice of many physicians in the physician community across the country, and have been for many years. And so my position as the Chief Health Equity Officer is actually a very new position as AMA, and in the last several years, they have made an explicit commitment to make sure that we are addressing issues of equity, elevating issues of equity, figuring out how we embed equity into our work and advocate for equity across the country, and especially as it relates to health, healthcare, and public health. So today I'm just going to kind of give an overview of the health lens as it relates to COVID, and more specifically to African American communities and communities of color. I think it's really important to set a foundation for this. And is everybody able to see? Just want to make sure you can see everything on the screen. Okay. In order to set a foundation for this, I think I just like to ground in what I mean by health equity and what's meant by health equity. And this is more of an outcome of having conditions, resources, opportunities, and power. And I say we have to have all of these, and this is for everyone has to have all of these in order to achieve optimal health. But most of us who are on this call and who are listening to this call are very aware that not everybody has these conditions in this country. And our goal isn't only striving for equality, and equality is absolutely critical and important, but equity implies that there's some level of injustice and lack of fairness, an inequitable distribution of resources. And so we have to focus on how do we work on power distribution, financial distribution, in order to actually have fairness and justice. And the reality is that there is tremendous gaps as it relates to especially health within this community, as well as in this country, and also gaps not just related to health, but economics, education, housing, many structural and social drivers of health. We see inequities, and they all impact the health of people. Our goal, though, is to hopefully remove these barriers and get to a point of liberation. So for the health of African American communities, even prior to COVID, this is life expectancy. Life expectancy is a very useful number in public health to kind of have a sense of, you know, what is the life expectancy? This is, or how long are people going to live based in the year that they were born? So this is using 2016 data, and it is demonstrating that Blacks have actually the lowest life expectancy, and you can see along the line here. Next is Native Americans, and then you can see whites, Latinos, and Asians. I thought it would be good to highlight, you know, an example of a city, because it really plays out with very similarly with cities across the country. I am in New York City right now. I also go between here and Chicago pretty often because our home base is in Chicago. But New York City is a city of neighborhoods, as most cities are. And if we look at the data and we look at maps, it helps us kind of see, you know, what's structured and how inequities are structured. And so looking at this first map and this map of neighborhoods in New York City, this is showing people who are dying too early. So we first have infant mortality, which is dying within the first year of life, premature mortality, dying before the age of 65, and life expectancy, as I mentioned earlier. So what I would love for people to recognize is that if you look at these maps, the same areas are dark and bright red. So just keep noticing that as I go through the maps, because it's going to tell us about equity, and it's going to tell us how inequity is structured in our country and across our cities. Looking at the next set of maps, now I'm putting over kind of what are the health outcomes. So these are examples of HIV diagnosis, psychiatric hospitalizations, and avoidable hospitalizations as it relates to diabetes. If we look, the same areas are dark red. Now let's look at the social conditions: poverty, elementary school absenteeism, jail incarceration. Again, the same areas are dark and red. So now if we overlay this with the race data and where do people live by race, we can see in those communities that were dark red that they're more likely to be, and that's not infant mortality, sorry about that. That's a little glitch there. That more people are in the dark areas are likely to be non-white. And so we can see that there is an absolute layover and inequity and a structured inequity as it relates to health, social drivers, as well as social drivers in the country. And most people on this call are very well aware of the roots and the historical context of racism and white supremacy in this country, our legacy of slavery and and segregation, and its impact on where people have been able to live, where people can get their jobs, the types of educations that they can get, and how far they can get through education. All of this, I like to frame, has impacts on health. So here's another way of looking at health again across a city. So the left one is New York City, the one on the right is Chicago. And if we look at the one on the left in New York City, it's looking at train lines. So it's looking at the subway lines, lines 4, 5, and 6, and then the N, Q, and R, if you're familiar with New York City. And it's giving, based on the stop, kind of the life expectancy. And so you can see, if you go up to areas of East Harlem, where there are more communities of color, Black and Latinos, and South Bronx, the same Blacks and Latinos, that the life expectancy, you can see it is lower. And then if you look at the Chicago map, the same thing along the lines. I actually live around this area in Chicago. This is the west side, and this is the south side of how people typically know Chicago. And for those who are familiar with it, are very well aware that communities within the west side and the south side are predominantly Black. And we can see very distinctly, and there's a huge gap in life expectancy between the Streeterville area, so the downtown area of Chicago, and the south side. So that means when I say that there are an excess number of deaths, that Blacks are dying early, as it is even before COVID even came around. Blacks are dying early. And so what we've noticed then over the last couple of weeks us in the health community, and especially us more so in the health equity space and the equity space. Reports coming out of places like Milwaukee, where some of their original deaths or initial deaths rather were amongst Black folks. We see hot spots picking up across the country in Chicago, in Atlanta, in New Orleans, places where are predominantly or heavily Black communities. And then we also hear more and more about the experience of physicians. And I think it's also really critical, based on what I showed you all earlier in terms of life expectancy, the experience of Native Americans who are also tremendously burdened and struggling at this point in time because of the previous existing inequities as it relates to the experience of being on a reservation and kind of pretty much isolated to an area, and all of the context that that creates and the inequities that that produces. So for Blacks, Latinos, and Native Americans, we are more likely to die, to have as well as to die from underlying conditions. And I put that in quotes because they're the medical underlying conditions. So diabetes, obesity, hypertension, heart disease, and usually at younger ages. And most of us have heard this in the language as it relates to, as it relates to COVID. We also know a vulnerable community is also the elderly, just to put that out there so it's clear. Charles Blow published this article yesterday in the New York Times. If you did not see it, the racial time bomb in the COVID-19 crisis. I highly recommend folks put it out. There are several articles that actually have come out in the last couple of days, really highlighting and elevating this conversation, because in all honesty, in most of the national conversations, folks are not elevating the issues of equity as it relates to Blacks, Latinx, or Native American communities. It's just really relied upon many of us from these communities to elevate these issues. Another sense of vulnerability in a way, and I don't like to say just people are vulnerable. I feel people are made vulnerable. Systems have made people vulnerable. Structures have made people vulnerable and set them up in ways that it's really hard to achieve. It's much harder to achieve optimal health. So other underlying conditions in the context of people's lives are the lack of quality and consistent health care, and that can vary by region. The South, which is heavily Black, also tremendous challenges with not only just overall the burden of disease, but how do folks get to health care when there are spaces that are closed down or they're further away. You know, I think the rural environment and the southern environment is very different than the city environment. There is a lack of trust for healthcare for amongst all of these communities, mainly because our historical context and experience with the health system. There's a greater experience overall of structural and social drivers of health inequities, such as low wealth, lack of consistent, affordable housing, and overcrowding, which happens in cities as well as in Native American reservations as well. And so it's been really hard for people to shelter in place if they needed to. And we've heard on some Native American reservations, there's even been a lack of running water. So the whole concept of being able to consistently wash your hands for 20 seconds is not real for everyone in this country. And some water quality, as we're well aware, is also not great, even if there is water that's running. So there are those considerations. We are also more likely to have frontline service jobs, such as janitorial jobs or food service jobs, which one means sometimes people are still working when everyone else is able to be home, but they are also more exposed to people in general, and they have to clean up places that the virus could be sitting and resting in. We know, especially for communities of color, our elderly are more isolated, and we have higher rates of incarceration, which I know will be talked about later in this conversation. And so there have been many myths and confusion and fear. I've heard Black people are immune as one of them. That's kind of one of the bigger ones that I've heard, and just to hopefully folks know by now that Black people are not immune. But, you know, and just speaking to, you know, my family and in certain neighborhoods that I'm in, of which my family are in, I'm hearing a lot of myths. And I think it's just really important that we challenge ourselves, especially as leaders, to challenge each other and our families to really dispel those myths as best as we possibly can, and not let them linger. There were initially a few cases in the African continent. This was initially The African continent is definitely experiencing COVID in the way that most countries are experiencing COVID. But because there were few cases, there was this perception that for some reason also we were immune. And I think there's just not a full appreciation for the seriousness of this. And I don't feel that this is necessarily a fault always of the community at all. I think there's just been really poor risk communication and guidance by many of our political officials, not so much on the local level. I think through this crisis, we have had to rely more so on the local, state politicians to really give good guidance and have good leadership. At the national levels where we have a crisis in leadership and I think in risk communication. Messages have been confusing, they've been unclear, and they can switch up every day. Truthfully, our public health leadership at the national level has been made invisible. The CDC has had challenges in being able to kind of put forward and be forward in a way that they usually are in some of our previous crises that we had related to like H1N1, Ebola, and Zika. CDC did an excellent job, and we're typically a very excellent country in terms of response from the public health angle. Our public health infrastructure was already had lots of disinvestment over the last couple of years. There were cuts on the national level that many people have heard as it relates to pandemic response and preparedness funding, and that always trickles down to the local level. There has been a lack of investment on the Indian service, and definitely a lack of public messaging in various languages for our extremely diverse country. And tremendous amount of fear as it relates to trust and safety in health centers, especially for those who are immigrants and of Latinx communities. And so our concerns are, as we move forward, and I think all of these have definitely legal implications, but one, is the healthcare capacity. We already know it already experienced inequities. We already know that there was, in a sense, kind of segregation at the healthcare system level as it is in certain areas. And more patients likely to be seen at one place compared to another place. But now add COVID on top of that. You have a healthcare system, you have healthcare providers who absolutely want to do their best job, but are completely challenged into doing their best job because of the system faults of themselves, but also just not having the equipment, as many people have heard, that they need to protect themselves and protect their patients. And I think we have to consider, what happens in these times of rationing per se, when the providers have to make decisions based on what they have and the lack of what they have. And so there are many ethical and equity, considerations in that. I would do a lot and know a lot about physician bias that exists. There's much evidence around that as it relates to race and ethnicity. And these moments of emergency crisis and having to respond fast, bias can be exacerbated. And so we have to be particularly cautious about that. Discrimination also in multiple levels can exist. There is, I think, a growing understanding, and there was a letter sent to HHS by Senator Warren and some other Congress folks talking about the lack of reporting of racial and ethnic data as it relates to testing. But the other piece of it, of what I've seen, is just there's been a lack of reporting of the racial and ethnic data, because a lot of the data actually relates to death and hospitalizations, actually does usually have race and ethnicity attached to it. But folks and the health departments aren't reporting out this data. And it's really challenging to know what's happening in our communities without that data. We need to see the data in order to know how to focus and target resources, and also how to just be responsive culturally in the most appropriate way. Again, there's the consideration and concerns about the lack of use of language services and the challenges of that. I mentioned earlier the access to testing. Also concern for in a physician organization, and have been speaking a lot with physicians of color, and they're experiencing issues around wellness, just their sheer ability to stay well and not get sick from COVID itself. Burnout, they are the folks who are more likely to think about equity considerations. And they are more likely, evidence shows that physicians of color are more likely to see people of color. And so they're working, extra hard, thinking extra hard, and really emotionally becoming very spent. And then they're financial. There are lots of implications for physicians all across this country, especially if you have your own private practice. We know of situations in which physicians have had to shut down their practices. And for those of us who are of color, and we already experience this gap in wealth as compared to our white counterparts, any financial rub will definitely impact us even harder. And just want to mention also that, there's also this recognition that reservations across the country, and this is Native American reservations, also there's been this volatility rather in the establishment of them. Some of them are becoming disestablished during this time, as well as right before this time, just based on kind of the politics and culture of our current national government. And another concern and consideration is ultimately access to treatment when it does become available. Are our communities of color going to get the same access? Is it going to be affordable? Are they going to have health insurance to cover it? And then vaccines is another one. Are we going to have the same access to vaccines? And we already have evidence and already know that we as Black folks are less likely to get vaccinated than other folks in the country. And tied to that is clinical trials. So there are several clinical trials going on in order to figure out what's the appropriate treatment, as well as vaccines. And the reality is, again, based on our baseline, is that Blacks are not engaged in clinical trials, and communities of color in general are not engaged in clinical trials in the same way that whites are. And so that's the nature of kind of where we are in terms of inequities and considerations. We as the AMA have definitely been doing lots of advocacy, excuse me, for physicians. Again, as I mentioned, really advocacy around telehealth, advocacy around ensuring that there is adequate equipment and protection for physicians overall. We are definitely starting to use our voice around the race and ethnicity data collection and the importance of it. And we are working to elevate others' voices so that we can hear what is happening within their community. So I'm sharing with you a webinar that we have this evening tonight with the presidents of all of the organizations that represent communities of color. So the National Medical Association, the Black physicians, the Latino physicians with Dr. Rios, the Native American physicians, and the Asian physicians. So if you're able to join us, we'd be delighted to have you. Thank you.
Thank you, Dr. Maybank. Next, we'll hear from Anthony Butler.
Good afternoon, everyone. I'm glad to be here on the webinar today. Most of you are like me, working from home or remotely. This is probably your third or fourth Zoom conference of the day, but I appreciate everybody taking the time out to learn about this important topic. So I believe I'm sharing my screen now. I want to make sure it pops up. Let's see, share. There we go. Close that, sorry. But again, my name is Anthony Butler. I am the president and CEO of Heirs at Empire Homes. We provide supportive services for formerly homeless youth and people living with HIV and AIDS in the Baltimore City and County area. Although we're not designed by mission to focus solely on the African American community, because of our geographic location, we serve about 97% of our clients are African American or Hispanic. So I thought that our perspective on this was critical and relevant to the topic of how COVID will impact our community. And specifically, I'll talk about how the business impact or the impact of COVID on the business community, both from from a business owner perspective and from the individual perspective as well, because the responses, they're interrelated and they are commingled. And they affect everyone, no matter where you are, either if you are an employer or your individual home life as well. So the federal government has responded in a few ways to COVID. And I think that I'll talk about some of those and how they will affect the African American community and communities of color as well. I think thank Dr. Maybank for her presentation, because a lot of the science and the research that she discussed goes across the board. It's not just for healthcare, but it's those same trends and gaps, not only in wealth, but in access to resources, will have an impact on the business side and your personal business and how you run your home as well. So we'll start today by looking again at what's called the CARES Act, looking at the SBA program that was announced on last Friday, March the 27th, for business owners. Look at some of those same provisions and the act on how it impacts individuals. Then look at some other federal responses on changes in leave that affect employees and how they impact on the employers. Then look at some of the collateral impacts that I think all of these acts will have on the African American community and communities of color. So we'll start with the CARES Act, which is the Coronavirus Aid, Relief, and Economic Security Act. Again, signed into law on March 27th, which I believe was last Friday. And it's really designed to provide it's a stimulus package, add some economic relief for individuals and businesses who have to change their operations as a result of COVID. And it did that in a few different ways. The first one is the payroll protection program. I think most small business owners are going to be interested in this and have some impact, or it will look at it as a way to relieve some of the impact of the modified operations caused by your jurisdiction. So whether you are in a state that is doing a mandatory shutdown, or you are in a city, because not all states have, but some cities are doing it on their own. If you have a mandatory lockdown or shelter in place, you can seek some relief from federal relief, at least, and then on how that has affected your business. So the payroll protection program is the one that most small business owners are excited about, because we're defining small business owners as people who employ, or businesses that employ less than 500 people. You have the capability of applying for loans up to a max of $10 million that are backed 100% by the federal government, and with a maximum interest rate of no more than 4%. These loans are done by your individual banking partners. So you would go to your personal business banker or your business banker, speak with them about their process, if the application period is open or not, and if what their additional requirements are for them to do an underwriting before you can qualify for the loan. Again, because it's a relief package, it's not for, the purpose is not for expansion of your business, but it's a continued operation of your business as you deal with the impact of COVID on your business and your community. So continue your operations, provide for payroll, so you don't have to lay people off, if that's something that you're looking at due to the lack of revenue stream because of some other coronavirus impact or policies. So that can include making your mortgage or rent payments, your leases, utility payments for your programs. I would imagine that's not, although not specifically mentioned, it will cover leases for your equipment as well. So whatever your general operating expenses are, should be covered by this relief if you were to qualify for the loan. And another interesting one, and I think most businesses will take advantage of, is that you can delay your payroll taxes, your federal payroll taxes, into January 1st. But again, I think, and borrowing some of the studies and the research that Dr. Maybank shared with us first, is that because there's already inequity in African American community and access to resource and capital, I think you're going to see a disparate impact on the Black business community, on their ability to actually access these funds through their banking institutions. So if you already were having issues with getting commercial loans or getting traditional financing for your business, this is probably not going to be a great revenue for you, or not a great avenue for you to help sustain your business. So you're still going to see, I think, some small business owners in underrepresented communities, they're going to have difficulty accessing these funds for a variety of reasons, whether it be their access to capital or to resources to help prepare the applications. If you don't already have established relationships with the bank, if you don't already have established relationships with your professionals. I've always called them, you know, a triad of advisors. If you don't have a banker, if you don't have an attorney, if you don't have a CPA, do you have the resources to really put together the loan packages that are going to be necessary to actually draw down these funds? That's critical in having it, because these are competitive funds and they're not unlimited. So I imagine it's going to be a first in, first out. Those who apply as soon as their banking partners open the application process and who have the resources right now are going to be the first ones to get access to it and be able to sustain their businesses. Traditionally, there just has not been, from my experience, for that every small business owner has a capability, not to mention small Black business owners as well. So I think although it's a benefit, and if you can apply for it, you definitely should. I think it's a great way to make sure you stay afloat throughout the rest of the year. But it's going to really take some probably house cleaning for small business owners who don't have either those relationships or those resources or those documents in place, whether it be your accounting systems and tracking mechanisms to make sure that you meet not only the banking requirements, but of the requirements of the loan. But again, depending on your market, we've seen the disparity in the SBA loans and how they're being approved. Although this one has generally lighter entry provisions, so it shouldn't be that big of a process. What we don't know is what the individual lending institutions are going to require from each borrower as well. The other interesting aspect of this, which is not in my presentation, but I know exists, and why I was interested in it and started doing the research prior to today, is that for once, it's actually this program is open for nonprofits as well. So if you are a nonprofit and you are serving the community, this is a loan, or at least again an avenue of to resources that are available to you to help you continue operations in your nonprofit as well. As heirs here at Heirs and Empire Homes, we are an essential nonprofit because of who we serve. So we are still open for business with some social distancing modifications, but this is something that we're looking at to help us modify our operations and to continue our operations moving forward. So I think there's an opportunity for those of us, and I found that most times that at least my peers across the country who are running nonprofits like ours or others who are helping underserved communities most often are African American run and led. So for those, for this, I think we'll be able to take advantage of that in the nonprofit sector a bit more, because we're required to have these relationships and required to have the documentation that you would normally need for a loan process anyway, you should be having because of your 501c3 status. So I think where we might have the for-profit businesses in our community might suffer and might not have the ability to get access to these loans on an efficient basis, I think our nonprofits in the community will be able to do so, because it shouldn't be anything different than what they're maintaining already as a result of their nonprofit status. So now we'll move on to the impact of the CARES Act on individuals. The critical one that I've seen not only here in Baltimore is that almost immediately we started to get calls from our clients who were laid off as a result of some impact or closure of their employer in result to COVID, either because of the staged shutdown that we've had in Maryland. We're not technically under a shelter in place, but we do have a stay-at-home order. So it's a nuanced response. I think our governor has been trying to make it as less impactful as possible, but it's still been pretty impactful. But a lot of people are being laid off as a result because their jobs are being forced to close because they're not essential resources or essential to the community or to provide services. So as a result, people don't have the income they did. So we saw it in two ways at our agency. We saw it from our case managers who were their daily job is to make sure and manage the day-to-day life of their clients. So the clients would call as soon as they were laid off. And then on the Empire Homes side, which Empire Homes is our builder and our property manager, we started to see, particularly earlier this week, phone calls from clients who were concerned about their ability to pay their portion of their subsidized rent for April and moving forward. So what our response has been is to make sure our case managers are advising all of our clients to, as soon as they are laid off, to apply for the unemployment benefits, especially now under the CARES Act and the increased ability to get those funds. So now you are there's an increase in the amount in the allocation. So now there's an additional federal benefit of up to $600 per week per claimant, which is significantly higher than it was before. I believe it was in the $300 range. And so now employees or clients have the ability, or citizens have the ability to at least receive a bit more compensation that'll help them through this period as they try to figure out if they're going to be able to return to work or not, or if they are not going to be able to return to work, at least to maintain their housing through the crisis. And the other critical factor here is that, again, your unemployment has to be related in some way to COVID. So you were laid off because of a forced closure by your jurisdiction, and as a result, you don't have income, and I think you're going to be eligible for it. And these benefits start, I think I'm jumping ahead. Nope, here we go. They start on, I'm conflating issues. But if you can show that you are laid off because of a COVID-related issue, then you're going to be eligible for these increased benefits, not only the increased amount, but for an additional period of time as well. So now you can extend it. You have an extended period to draw down these benefits of up to 13 weeks if you're still suffering or still unemployed as a result of your employer's response to handling the COVID outbreak. Additionally, and a way of supplementing their income is that every citizen up to certain income caps are going to be able to get a recovery rebate, as it's officially called in the act, but a stimulus check is what most people are referring to it as. Each individual can get up to $1,200. We'll get $1,200 in 2 payments, or $2,400 per household if it's a married filing jointly, and an additional $500 per child. So anybody who their adjusted gross income was less than $75,000 will get the full amount, and then it starts to phase out on a sliding scale above that. But most people that we're talking about in our community, at least for my client base, I should say, is going to be able to apply for those, and this is across the country as well. So anyone who meets those guidelines should be able to receive their stimulus checks. The questions we've been getting is how do you get them? Where are they coming from? Some of the guidance I've seen indicates that you can, even if you have not filed your taxes for 2019, you should still be eligible to receive the funds. I believe they're going to go from the 2018 filings. And if you haven't filed, you're still going to get, in my understanding, that you still should be able to get a benefit of this resource as well. I just received, literally right before the webinar started, some indication that even they're looking at Social Security accounts as well, and so that you may get a direct deposit into your Social Security account, and that's how you're getting, that can identify you, or it's going to be in your personal checking account if you're receiving your tax refunds that way. But again, all of this is unfolding rather rapidly, so I would advise you to check with your accountant and your CPA or your attorney for any additional information. But those resources are out there, and I think it'll be something that will have an impact on keeping people afloat. Some of the collateral consequences of COVID that I see happening longer term will be some instability in housing, and hopefully that this, with proper guidance and with a little bit of money management, that this will assist people with being able to maintain their housing, even if they're in a jurisdiction that is currently halted evictions like we have in Baltimore City. But eventually that moratorium is going to be over, and landlords who are also struggling are going to start to pick up where they left off, just so they can maintain their income as well. So I believe that this, hopefully the stimulus check will be able to assist families in maintaining their housing. Additionally, there are some other other business impacts that go both ways for both the employer and the employee, and that is the expansion of leave policies under the act as well, or a different act, and that's the Families First Coronavirus Response Act, divided into 2 main substantive sections that expand the ability for employees to take leave time, family medical leave time, and a new and a significant change, required paid sick leave if that leave is related to COVID. These leave policies took effect yesterday, so our webinar is very timely. But if people who are laid off as a result, again, of your employer's response to COVID, they can still use Family Medical Leave Act. The act expands some of the requirements of who's eligible. You can, and so the first one being that you are now eligible for FMLA leave under this act if you've only been employed for 30 days or more, as little as 30 days. Previously, there was a significantly longer period of time you would have had to have been employed before you could be eligible for this type of leave. The Families First Coronavirus Response Act changes that. As long as you were employed 30 days prior to the time you were laid off, you'll be able to take advantage of and be eligible for the benefits under the act. And so now, again, another significant changes, you don't have to exhaust all of your accrued paid leave time first. Employees have the benefit of using the first 10 days of using all of their time under the expanded leave requirements under the act, and then can then apply their leave time later if they choose to do so. For the employer side, the first 10 days does not have to be paid of leave. The first 10 days are unpaid, so you still then, as an employee, could use your accrued leave time, whether that be sick, paid, or vacation, or whatever your employer allows you to do. You can use that paid leave time, and then the act will kick in on the 11th day, allowing you to then receive payment for your leave, not at the full rate of 100%, but you would be able to get at least 2/3 of your regular rate of pay. What I'm not sure about, which is, again, we're still all trying to figure this out, is that if you're on extended leave and you're only getting 2/3 of your rate of pay, can you still also apply for the unemployment benefits under COVID as well? My guess says yes, because you're still going to show a reduction of income, just not sure if your state would allow it, or if your unemployment office in your jurisdiction would approve that. So that's just my opinion, but I would advise you to consult again with your employment lawyers in the area if you're looking at that and if you find yourself in that situation. What I would say to our small business owners and our employers is to make sure that you understand this. Again, this is where it's critically important that you have access to those resources for someone who can help you navigate these requirements. So it's becoming, although it's necessary, and I think you should have it for your business anyway, it's been my experience that most small business owners don't have someone who they can readily call. So I think it's going to be critically important, again, for these small business owners to have someone who can help them navigate through all of these significant changes in federal legislation and how it affects their business and how it affects their employees. The other benefit for the employers based on this leave, if you're going to be, because it is a great benefit to the employers that we're not accustomed to. Typically, FMLA leave has been a non-paid leave. So now that employers are going to have to pay at least 2/3 of their employees' salary or compensation while they're out on this new expanded leave, they at least get a benefit of a tax credit of 100% of their wages they were paid under leave for these reasons as a response to COVID. So I think those are, again, they're out there. They're available for small business owners in the Black community as well. But I think for me, my belief is that we're going to have difficulty looking at how we apply for those. Do we have the resources in place now? If not, how do they find those resources, especially when a lot of businesses are closing and not available? Most of these professionals who would be there to assist are generally considered essential employees or essential businesses and services, so they're available. But do these small business owners have the ability to retain, pay for, and to use them is a different story. Again, there's always been a wealth gap and a gap to access and resources before COVID that does not change, and it's going to worsen, in my opinion, as a result of COVID. So you're still going to see this businesses in Black and brown communities struggling to maintain, stay open, or even able to reopen after the pandemic has subsided and we flatten the curve. Not sure what the impact is, but I don't think it's going to be. I think it's going to be significant for the Black community. So based on these changes, I think you're going to see, again, some additional impact on Black and brown communities on the collateral impact of COVID. So I do think that housing instability is going to be a real thing that we're going to end up dealing with well into late in this year, if not the beginning of 2021. Because of the loss of income, you're going to see people not being able to afford where they currently live, and looking at agencies like mine for assistance on housing. So you're going to see a burden, or at least an exacerbated need for subsidized housing, for the nonprofit sector to step up, and for local communities and governments to really provide safety nets to make sure that we don't increase the level of homelessness across the country. Again, relatedly, you're going to see some food insecurities as well. Typically, when you think of food deserts, with the ability to get nutrition at a grocery store within your neighborhood, I think now, especially with restricted travel in some jurisdictions, stay-at-home orders and others, although you can leave to go get these items, these necessary items to survive, it's now intertwined with your ability to generate income. So if you're already restricted in travel, you don't have the income because you were laid off because your job wasn't a secure, a essential job, or you were being paid in other ways, I think you're going to find families again struggling to find a way to make sure that they feed themselves and their children through as we deal with this crisis. And again, I see that continuing beyond the flattening of the curve as well. As Dr. Maybanks already discussed in detail, the access to healthcare again is going to be critical, especially with people who already have compromised immune systems or are at risk. Not only are they at risk of COVID, but they're going to be at risk of just maintaining that. How do they get access to their medication? Is it going to be shipped to them? Can they leave the home to go pick it up? I think those things are going to be critical moving forward, and then we need to pay attention to as a community on how we provide a safety net for those people who are going to have limited access to healthcare and housing and food, et cetera, moving forward. And again, I do see probably the longest impact is going to be employment. The ability for companies that are able to stay open or reopen, and then their ability to rehire and ramp up to where they were to our pre-COVID days is going to take a while. And I think that as a result, communities who are already underrepresented and there was an income gap anyway, are going to bear the burden of that gap continuing well beyond the response, or at least flattening of the curve of the rate of the spread of COVID, and we're back to normal, whatever normal is for you. I think we're still going to have some lingering benefits around all of these things in the months and possibly all of next year as well. So I'll pass it back off to you, Angela.
Okay, thank you very much, Anthony. That was very informative. Now we're going to turn to Ashley Baker, who is the chair of the Criminal Justice Committee and the vice chair of the African American Affairs Committee of the Civil Rights Section. Ashley?
Hello. Thank you guys for joining this webinar and getting all this good information. I'm going to talk about how COVID-19 is impacting the criminal justice system, especially African Americans and communities of color. The most pressing issue in the criminal justice system in relation to COVID-19 is the safety of jails and prisons. And this is because things that we can do, precautions that we can take in our own homes and in our own communities, they can't take in jails and prisons. One thing is that there's a lack of hand sanitizer. In most cases, hand sanitizer is considered contraband. Okay. And in some cases, there's a lack of soap, where you may have access to water and clean water, you may have a lack of access to soap. And in many cases, inmates have a lack of access to paper towels or things to dry their hands off with. And in most cases in jails and prisons, you have close quarters. So most inmates share a cell, and that makes it nearly impossible for them to maintain any significant distance from another person. in most jails, well, not most jails, but a lot of jails, you have overcrowding, and that is also an issue as well. There's a shortage of medical staff and equipment, including things like ventilators that we know are essential for treatment with complications from COVID-19. There's also an inability to quarantine people without subjecting them to solitary confinement. There's also a lack of testing. Some prison systems have opted to stop testing inmates once they have a certain number of cases, and that could also be problematic. Okay, so now I want to turn to a case that most people know about. Most people know about what's going on at Rikers Island right now. So on March 19th, Rikers Island had 1 case of COVID-19. By the 27th, they had 103 positive cases of COVID-19, and these are just the numbers among the inmate population. As of Tuesday this week, they had 180 cases of COVID-19 among inmates and 141 staff members to test positive for COVID-19. I haven't checked the numbers for today, but I'm sure they're nearing the 200 mark. And just to put a bit of context on this as it relates to African Americans and minorities, according to the New York City Department of Corrections, about 53% of the inmates in Rikers are Black. 92.5% are minorities. So this is definitely something that is affecting the Black community and the minority community. Another thing that you have in jails is what's called a jail churn, where you have a significant number of people moving in and out of these facilities. And if you couple that with the staff members that have to go home at night, you can see how community spread can be impacted just by what's going on in Rikers Island. To put a bit of a larger context on this, according to the NAACP, in 2014, there were 2.3 million African Americans that are incarcerated in the United States. African Americans and Hispanics make up 56% of jail and prison populations. According to the Federal Bureau of Prisons, 37.5% of all federal inmates are Black. About 42% of all federal inmates are minorities. Okay, so all of the efforts that I've seen to have early release from jail facilities and prison facilities have been based on 2 things. One, whether the person is elderly, and the other is whether they have a pre-existing chronic condition that would lead to a higher chance of complications between COVID-19. So this chart just shows you the percentage of people that have chronic conditions in jails, state prisons, and federal prisons. And those numbers are compared on the right to the United States population. I want to draw your attention specifically to something that isn't usually focused on, especially as it relates to pre-release, and that's cigarette smoking. According to the World Health Organization, smokers are more likely to contract COVID-19 because of the finger-to-lips contact required for cigarette smoking, and the fact that smokers are more likely to already have lung disease or reduced lung capacity. Additionally, according to a study in 2016 by the Department of Health and Human Services, 59.7% of Black men in state prisons are smokers. 26.2% of Black men in federal prisons are smokers. And according to a 2012 report from the US Department of Justice, about 52% of Black prisoners reported having a chronic condition, and about 50% of Black jail inmates reported having a chronic condition. So another aspect of this is the existence of copays. So a lot of people don't realize that inmates, prison inmates, are not exempt from copayments. And on average, prisoners make between 14 to 63 cents an hour. And in some cases, a single visit to a prison doctor can amount to almost an entire month's pay for someone who makes $6 a month. This is problematic because inmates may not seek treatment, or they may not voice their symptoms because, you know, they already know that they have an inability to pay. So that's another aspect of this. So what's being done? Last Friday, the U.S. Attorney General directed the Bureau of Prisons to reduce the federal prison population by increasing home confinement of those elderly inmates with underlying conditions. In California, 3,500 inmates are going to be released. In New Jersey, 1,000 inmates will be released from jails, and another 1,100 in New York. Now, while these numbers are great and it's a step in the right direction, these are definitely baby steps compared to the amount of people that are incarcerated in this country. So here are a couple things that we don't know. We don't know what departments of corrections on the state level are doing to ensure the safety of prisoners. We don't know if they're providing soap, if they're going to change their banning of hand sanitizer. We don't know if they're gonna now supply paper towels or things for inmates to dry their hands with. We don't know how often they're gonna clean jail cells. We don't know those things because there's a lack of transparency between the public and the departments of corrections. And in a lot of cases, there is a lack of transparency between prison officials and the inmates themselves. We don't know how the departments of correction will address COVID-19 cases. We don't know how they're going to have this access to medical care, especially in light of the overburdened healthcare systems that we already have right now. Some prison systems are transporting patients to local hospitals. However, there are other prison systems like where I am in Louisiana that have planned to take COVID-19, people that have tested positive for COVID-19, inmates to other prisons and house them in other prisons. And that can be problematic because the same conditions that were in one prison are in the other as well. And specifically here in Louisiana, they are considering using a building that was deemed unfit to house prisoners as the place where they're going to treat COVID-19 patients. So that's problematic in itself. Another thing we don't know is what level of discretion is being used to decide who is released. So some jurisdictions have reached agreements and the person, the inmate, is deemed to be eligible for release unless there is a motion of opposition and we just don't know how that will affect minorities and how that will affect African Americans. We don't want to have a situation where we look back and realize that the demographics of those that were released or authorized to be eligible for pre-release is disproportionate to the numbers of those that are incarcerated and more likely to have complications with COVID-19. So that's just a brief look at what's going on in the criminal justice system right now.
Thank you, Ashley. And now we'll turn to our final presenter, Juan Thomas, former president of the National Bar Association, to discuss voting.
Good afternoon, everyone. Can everybody hear me?
Yes.
Great. In the midst of this pandemic that we're in, our democracy must continue. As you know, America historically has been marred by infrastructure in our voting systems that are unstable, excludes too many people, and are prone to partisan manipulation and oftentimes deliberate voter suppression within often our community, in particular, the Black community, and other communities of color and young people. In the midst of this pandemic, these issues become even more problematic. It is important, as we deal with this ongoing crisis, that we think about ways that we can reform our American election system, ideas around automatic voter registration, mail-in voting, online voting, and other measures to secure our electoral system. Our electoral system and our democracy has never faced this type of challenge in our lifetime. Just today, you might have heard by now that the Democratic Party has decided to move its convention till August, now August 17th. It was going to be in mid-July. And so states and those who are active in the political process are trying to figure out how to conduct an election in the midst of this crisis. Voting is a very fundamental, basic right within our democracy, but as we all know, too many people are locked out of the process. There are vulnerable communities that are under attack, and this pandemic does not make it any easier. Historically, we remember in 2016, our election was under attack by our adversaries in Russia, targeted our election officials, email scams, and other ways that undermined our democracy. Because of the crisis that we're in now, we've got to be very careful and very intentional about protecting people's right to vote, particularly in vulnerable communities, and in particular in the Black community. But right now is a season where a lot of nonprofit organizations and other organizations would be conducting voter registration drives. However, that's come to a halt. There's no way to contact or be in front of people to do voter registration. At community events, church services, there are no rallies, there's no community meetings. Another challenge that we're facing is students who've registered to vote on campus, particularly historically Black colleges. How do they vote now if they're no longer on their college campus? How are they going to vote? Can they vote by absentee? Should they re-register back at their home states where they live? And this impacts upcoming primaries. And so if you're a college student in Ohio and you registered to vote in Ohio, and that primary has been delayed until now June, but suppose you actually live in Illinois, where I live, how do you vote in that Ohio primary election now, since it's been delayed? I know this is an issue in Atlanta, where their primary has also been pushed back. There are students on my former campus, Morehouse College and Spelman College in particular, where those students are trying to figure out how they're going to vote in the Georgia primary when they are now no longer on campus. And so These challenges are new, but have to be addressed in very real and significant ways. Congress just allocated $400 million to figure out ways to vote by mail. To quote my Spelman sister, Stacey Abrams, she said that's just a drop in the bucket or a nice down payment. What experts are really saying that we need is more like $2 billion to put together a national program and system for states to allow people to vote by mail. However, in vulnerable communities, particularly in our community, there is an issue around making sure that if we vote by mail, that the postage needs to be paid so people can return those ballots. Not everyone is in a position to afford the proper postage that may be needed. And so again, making sure not only can people vote by mail, but also return the ballot with a paid postage. This pandemic has already impacted elections so far this year. In my home state of Illinois, in Cook County, which is where Chicago sits, as 33%, there was a 33% less voter turnout in our primary election this past March, on March 17th. In particular, I can even give you another statistic, another number. In my hometown of Aurora, Illinois, which is a western suburb of Chicago, I was a candidate for the state legislature. We anticipated between 10 to 12,000 voters who would vote in my legislative district. On primary day, 7,200 people voted in my district, down between 3,000 to 5,000. And on a personal level, I can tell you, I know several people who later apologized to me because they did not come out to vote because of the scare of this pandemic that we are facing. And so this has real implications in voter turnout and people's commitment to vote, even those who are wanting and willing to vote, who are regular voters. And so here's two things I want you to be mindful of. 40 states currently offer online voter registration. 10 states do not. So in 10 states in particular, I'm going to give you the states where there's a significant Black population that don't allow online voter registration. That's Texas, Mississippi, Arkansas, North Carolina, and New Jersey. The other states are North Dakota, South Dakota, Montana, Wyoming, and Maine. But in the first 5 states I mentioned, there's a significant Black population in those states. Those states don't allow online voter registration. That's problematic in terms of registering 18-year-olds to vote in those states, people that may have moved, that may need to change their voter registration because they've moved to that state or within that state. They can't do that online. And so how do we create a democratic system, small d, that allows people to update their registration or change their registration or become newly registered voters in those states? As we all know, we have an election on November 3rd of this year. Let me assure all of you that the president cannot, by executive fiat, just delay or change the election. That would have to be done by an act of Congress. And even if they delayed the election or changed the date, under our U.S. Constitution, they cannot change the expiration date of someone's term of office. And so the current administration's term of office will end January 20th, 2021 at noon if he's not reelected. And so this is a fluid, ongoing process where we're trying to figure out in the political community, how do we conduct an election when you can't campaign around people? There are no campaign rallies, events, fundraisers, activities around the normal electoral process. And then how do you actually conduct an election? There are, from a political perspective, 13 states are considered to be competitive in terms of deciding who will be the next president of the United States, what we call swing states in politics. I want to give you the states where there is more than 10% or more Black population. Those states are Michigan, Pennsylvania, North Carolina, Virginia, Ohio, Nevada, Georgia, and Florida. Again, those are the 8 states in our country that are considered swing states where there's a significant Black population. And the impact of a voter suppression efforts and the impact of people not coming out to vote because of this pandemic could have far-reaching implications on who's elected to public office, not just nationally, but also on down ballot races for Congress, the US Senate, state legislature. What's the long-term impact of that? We are facing a census next year. How resources are allocated is based upon often not only the census numbers, but also who is drawing those legislative and congressional district maps. These elections in 2020 will dictate who's at the table to draw your state Senate seat, to draw your state representative seat, or your delegate seat. I think in Maryland they call it a delegate in the House, the lower chamber. In other states across the country, how congressional districts are drawn. All of that is decided by state legislatures and governors. And so it's critically important that we in the legal community work to protect people's right to vote and make sure voting is easier. We live in a society right now where political forces, like I said in the beginning, are trying to make voting harder. This pandemic is even more problematic. So on top of the structural barriers that we're dealing with, we're now dealing with the reality that there's a real health crisis in the country there that may seriously impact people's desire to vote, to want to get out and vote. And so we've got to make a process where it's streamlined, where quite candidly, people are allowed to vote by mail, which means we've got to work on make sure people's addresses are correct and that they can get the ballot back, but also online voting. Online voting can be problematic because a significant percentage of our communities don't have access to the internet. And being able to get online to vote or register to vote online. And so how do we close the digital divide is another issue that we have to address in our society as we face this 2020 election. So I will pause there and thank you for allowing me to present this issue in this webinar.
Thank you, Juan. What we're going to do right now, throughout the program, we have been receiving numerous questions, some of which I have attempted to answer on my own. Our apologies in advance that we won't get to all of them, but I do want to raise a few of them and open it up to our panelists to respond. We'll start with voting since we just finished speaking about that. There are some viewers who believe that voting by mail may not be an option anymore because it is rumored that the Postal Service may not survive the summer without congressional assistance. Do any of you have any thoughts on that?
Yeah, I'll respond to that. Like I mentioned, just this past week, Congress allocated $400 million to put in place a vote by mail system. However, that is just a drop in the bucket to what is actually needed. If we move to a vote by mail system for the entire country, it's estimated that we need over at least $2 billion. Some are saying $4 billion. Some of those resources will be allocated to make sure that the Postal Service is operational and that we have enough postal workers who, one, can maintain their health and pick up the mail and deliver those ballots back to the proper election authorities. Remember, even though the Postal Service is a federal organization, it's federal, our election systems are led by our states. So there's got to be serious coordination between the U.S. Post Office and our state election authorities in returning and collecting these ballots. And so that's why we need more resources devoted to this problem. And like I said, Stacey Abrams just put out a statement about a day and a half ago, because she's working on these issues, particularly in Georgia and throughout the South. She says that $400 million is just a down payment. The real number that we need is between 2 to 4 billion.
Thank you. With respect to unemployment, I'm opening up these questions to everyone, but the question is, how would you handle situations in which a client was told that they were not qualified for unemployment because they had collected unemployment in the previous year, and now they have a claim as a result of COVID, and they may or may not be eligible?
Right. So I think it's still going to be dependent on what your state requirements are for unemployment. So if you've already exhausted your benefit in the previous year, I haven't seen any language that says you will be eligible because of COVID now. So I would have to defer to whatever their state office does and how they generally check eligibility for COVID. For unemployment. And then, my guess would be, though, that if you've already exhausted your resources prior to this, that you probably won't be able to get it moving forward unless for some reason there was a period of employment where it reset. But if there wasn't that period of employment where the benefits reset, then I think they're still going to be, they're probably only relief they're going to probably get is going to be the stimulus check.
Okay. And then another question is, what about those with Section 8 vouchers? Will they still get a check? What about the homeless population? Will they still get a check?
Is my understanding.
Undocumented individuals?
Well, I think the challenge will be the undocumented individuals, just by the nature of how we use that term. But I think everyone else will. The problem would be with homeless individuals, it'll go to the last known address, is my understanding. So the check is not a function of what entitlements you're already getting in the country. So I fully expect all of my clients who are on subsidized housing to still get a check as well. Even if they never filed the taxes or anything else, because the government knows about them because they're getting a subsidized service already. But the only one that we're working through now, I think will be challenged, not only for the subsidy, for the stimulus check, but also unemployment benefits. So we've got one of our programs is designed to serve undocumented individuals. And although they're receiving subsidies, they are still undocumented and aren't filing taxes, and typically don't have employment that we will call legitimate. So they don't have W-2 or 1099 employment. So the issue becomes, how do they get benefits? I don't think they are, because they're really mostly off the grid and there's no way to get them the funds. Again, that's what we're still working through it, but that's my assessment right now.
Okay, thank you. And then we have a question about prisoners who are being released. Where are they supposed to be housed? And especially for the African-American community, who might also be low-income individuals, how is that being handled and taken care of as prisoners are being released, or consideration is given to whether or not prisoners will be released?
Okay. As I've seen it, inmates that are eligible for pre-release will simply return to their homes. And in cases where people end up homeless, some cities have started to address homelessness by converting hotels, building tent cities and things of that nature. But I think that this is another one of those issues that that we just simply don't know the answer to because of the lack of transparency. So if there is a plan by a local Department of Corrections, that plan hasn't been made public.
Okay, thank you. And Dr. Maybank, what would you suggest? I mean, obviously we are doing this program to highlight these issues, and it's understandable if we don't have answers and solutions at this moment. The key right now is to get the issues on the radar of people who can make a difference. But if you had to determine things that may ameliorate some of these health disparity issues that folks will be facing as a result of COVID, what might you put in place?
Yeah, I think one is just we need a better centralized effort in terms of response, in the immediate. So we need more clarity and just more clear communication. I'm in New York, and a lot of folks have relied on our governor, Cuomo, to kind of hear from across the country, what is happening every day and getting updates. However, we need to have that at the national level, and we need to have it from our public health experts. And so, that is one. Number two, there's also a need to have support in coordination to support states at a national level so that states are not competing for procuring or getting personal protective equipment for their staff. That just absolutely shouldn't be happening at this time. So the central coordination and purchasing of equipment is absolutely critical, whether it's ventilators or personal protective equipment. And then the third, I would say at this time, what doesn't typically get elevated and what I mentioned before, is this need to better understand what is happening in communities of color. We need, it's a challenge because one, we've been late in our testing as a country overall. And the recommendations at this time in many places is that we're not even testing everybody. We're really testing those that are most critically ill. So we potentially have a gap of information of what we're learning about people at a baseline, but then for communities of color who already experience distrust of the system, who potentially aren't going to come in, we aren't going to have that data, and we're going to be undercounted. There is data, though, that is collected by local health departments across the country. They do have this data, but we need this data to be released so that we have an understanding of what to do and how best to respond across the country and in a collective way.
Thank you. There are numerous concerns that the African American community is facing, obviously. What I want to do, because we are running out of time, is to give each of our panelists about 2 minutes to sum everything up. And if you are able to recommend strategies or at least pose questions like Dr. Maybank just did, so that folks who are in the position to implement certain policies can hear this. So I think we'll start with Juan, and then we'll go to Ashley, and then Anthony, and then we'll end with Dr. Maybank.
First, thank you, Angela, for organizing this conference, this Zoom conference. It's an important topic. I want to thank you for your leadership in doing this. But I will simply just share with the listening audience that the first thing I want you to think about doing is I want to offer you this website, the Election Assistance Commission, www.eac.gov. And there you can follow all the latest updates and information regarding election issues, voting rights issues, how states are dealing with this virus and its impact on voting systems in respective states. There's also useful information that you can use to educate those in your community around safe voting habits, particularly in these upcoming primaries. The second thing I want to offer is, for those who can, please partner with your local and state community organizations to help verify people's voter registration. Since we're all at home right now, since we're all kind of, working from home, this is an opportunity for us to verify that where you are living, where you do reside, is where you are registered to vote. So we encourage everyone to take the time to verify people's voter registration information at their current addresses. And also learn your local rules. What does it take to register to vote in your respective city and state? What IDs are accepted? What information do you have to have to verify your current registration? And then for states that do allow you to vote by mail, that do allow you to vote by absentee ballot, learn those dates and those deadlines. Those dates and deadlines are real and cannot be manipulated with respect to local rules. And so I think the central message is we have to work to make voting safe and easy in the midst of this pandemic that we're facing, and realize that we can't allow our democracy to be put on hold because of this crisis. We have to have a fair election. We have to make sure that voting is fair and safe and easy. And it's critical that we don't face a situation where voter turnout is lower and critical elections that we're facing are lost because people could not access the ballot or they were afraid to go out and vote in a meaningful way. And so, again, thank you for listening, and let's do our part to make sure we have a fair, equitable, and just election this November.
Thank you, Juan. Ashley?
Okay, so what people can do is, I wanted to talk about the things that we can focus on, and that is the release of those who are medically fragile, those that are considered elderly, and those that are within 6 to 18 months of their release date. And the reason for that 6 to 18 months is because those people are due to be released anyway. So the longer that they remain in those facilities where COVID-19 is spreading rapidly, the more likely that they will have COVID-19 once their release date gets here. And we don't want that to contribute to community spread. The next thing is to stop charging medical co-pays in prison. Lower the jail admissions by opting to give citations instead of making arrests. Some local sheriffs across the country have already decided to do this. Another thing that we can do is to reduce unnecessary parole and probation meetings. Eliminate parole and probation revocations for technical violations. And we talked about Rikers earlier. A significant number of that jail population is in there based on probation violations, technical violations. Another thing that we can focus on is making jail and prison healthcare policies public and transparent, not only to the general public, but to the inmates themselves. And the last thing that I want to emphasize is providing soap and hand sanitizer and access to paper towels. The resource that I found very helpful is the Justice Collaborative, and their website is thejusticecollaborative.com/COVID-19. And on there you can find different resources for prosecutors, for public defenders, law enforcement, and other public officials, and they're categorized, and they just kind of lay out based on your position what you can be doing to help in this effort. Another thing that's been done is in New York, they've been filing writs of habeas corpus, and what they've done is started to file mass writs, which include 30 to 40 inmates in one writ. And they've been very successful in that effort. But you know, I'm aware that a lot of people on this webinar may not be lawyers. You may be non-lawyers or even law students. So another thing that you can do, and you can reference the website that I just talked about, they have letter templates for geared toward local officials with all of these key points in there, and you can fill that out. You can send that to your local politicians, and you know, just try to affect some change in your community.
Thank you, Ashley. Anthony?
I would say to stay informed, especially if you are a small business owner and you've employed people. There are a lot of complicated and new restrictions or regulations that you need to be aware of that you could possibly even be run afoul of if you're not up to date on some of this information. So if you don't have advisors on your team, this is the time now. Again, as Juan said, you're sitting at home, most likely can't get out to conduct your business. Use this time to really strengthen your business and to get your affairs in order so that you can qualify for and apply for the resources that are out there available to you. If you are an employee in your home, same thing. Use this time to get your affairs, get your house in order and get things available at home. So not just checking if your current voter registration is accurate, but looking at your finances, try to predict or at least to project what you're going to need over the next three months at least. So that way you can plan for what's to come and still provide for your family. One thing we've done at AIRS is to make a COVID resource site. Again, there's information all over the place, but you can look at our site if you want. I'll share it now. I think we still can. So this is our, oh, nope, that's not it. So hang on, there it is. You can look at our page. It's COVID, airseffect.org, that's COVID-19. We've got resources that are not just local, but national as well. So you have an opportunity to go and click any link to find out information on general information about the virus, some of the programs that are released, resources for helping you navigate services. If you're in Baltimore City or County, it's going to be even more detailed for you because we have specific local references. And also, if you're a service provider and you are running a facility that is essential, some guidance that we've gotten from across the country that I'm collecting and treating this almost like a clearinghouse for information. If you are in the nonprofit space and you need some assistance or want some assistance moving forward, feel free to reach out to me directly. My information is on on the PowerPoint that will be posted later. And if I can quickly share it now, for those of you who want to do a screen grab, feel free to copy that information now. It's got our social media, again, the website here for our resources that we're collecting for COVID. And you can reach me at any of these forums and I'll reply directly. But again, stay informed, do what you can for your community, stay safe, wash your hands, cover your cough, wipe your spaces.
Thank you. And Dr. Maybank, we'll end with you.
Sure. So one, I just want to take the time to thank all the healthcare workers and other like frontline folks that have been, really working day in and day out to help protect us and other people and Americans across the country. And I'm sure there are several on this call as well. And my lasting advice, I already gave kind of my strategies in terms of what I think is needed, but it's the same of just what was said. It's just, really important and critical for folks to stay home at this point in time. Very important to continue washing your hands every 20 seconds, not every 20 seconds, my goodness, for 20 seconds, but quite often. I'm going in and out. If you're in contact with somebody who has had COVID, make sure that you are quarantining yourself, as well as if you test positive and you have mild symptoms and you're able to stay home, make sure you're quarantining as well. But everyone, just be safe, be well.
Thank you. I want to again thank President Judy Perry-Martinez, also our section chair, Wendy Mariner, Cynthia Swan, the co-chair of the African American Affairs Committee, and our many, many, many co-sponsoring entities And last but not least, this incredible panel who was able to put together a presentation in a very, very, very short amount of time in order to get this urgent message out to all of you. Again, we want to note that we've only highlighted a few of the many issues that could be raised on this topic. And we also know that identifying these issues is just the tip of the iceberg when it comes to problem solving. We hope you enjoyed this webinar and recognize it as a good first step to ameliorating some of these inequities. I want to remind the attorneys on the call that you can make a difference by joining the ABA section on civil rights and social justice. There are numerous opportunities to write, to educate in various forms, and to help draft and create policies that ultimately will have a tremendous impact on the country. For more than 5 decades, the section and its members have worked on hundreds of issues addressing a broad range of civil rights, civil liberties, international human rights. We'll continue this programming on COVID-19 and dig deeper into some of these issues that were addressed today in the days and weeks to come. All of the materials that our panelists used today will be posted online, along with the references to the various websites that they pointed out. And you can find that at www.americanbar.org/CRSJ. So on behalf of CRSJ, we hope that you and your loved ones remain safe and healthy, and you enjoy the rest of your day. Thank you so much for tuning in.